What outcomes matter most in value-based care, and how does stronger coordination help achieve those outcomes?
So it's hard to really pick the most important outcome, but I think a big one where it makes all three sides happy, it makes their doctor, the patient, and the payer happy is when we prevent readmissions to the hospital when possible. So that goes into transition of care and having that outreach to the patient upon discharge and getting them scheduled with their primary care doctor, making sure that their medications are reconciled, and having a high touch on these patients after discharge to really avoid the patient winding back up in the hospital.
There's a statistic that says about 50% of patients who do not see their primary care doctor after a discharge are readmitted. So it just goes to show how important is the follow-up visit is, whether it's transitional care management, something with their care manager, or the visit with their doctor, is to preventing that readmission.
There's always such a focus on utilization, right? We want that reduction in cost. And when we focus on the general clinical outcomes, there's our blood pressure in control, our A1C. What's great is that's when you see the disease stability, and then we end up seeing the other outcomes trickle down, right? The utilization outcomes, so fewer admissions or no readmissions. Patient experience, the patient's going to feel supported, not lost in what's going on. And then for the customer, that's when they have all the financial values as well. They have the predictability along with the aligned reimbursement for their services. So when there is that focus on the patient and the patient health outcomes, everything else, I think, naturally just falls into place.